welcome back. So today we're going to talk a little bit about how to move our shoulders to minimize some of the pains that can appear when our shoulder is off position. So last week we talked about how the way we hold our position of our rib cage, of our sternum, of our shoulders, how that can contribute to pain that shows up overnight or gradually over time. So if you took note of what you are doing, I want you to think about, what do you do when you reach up overhead? Okay. Now, if you watch me when I reach up overhead, my hand goes up, my elbow follows, and then my shoulder is rotating at the same time. And if I bring it back down, kind of the opposite movement happens. Now, you can see that my shoulder starts in a lowered position. If I start where my shoulders are high because I've used these straps due to stress or anything else, if I start going up high and then I lift up, you can see the mechanics of my shoulder is different already. My shoulder's already elevated and I can start to feel a pinching on the top of my shoulder. And I can even feel it going up into my neck a little bit too. And then there's more pinching on the top and then it goes away. So if you have shoulder impingement, that's a typical sign, because I've changed the mechanics, and if I'm dropping down, you can still see the shoulder jammed up in place. So that's hard to change, but one thing you can do is work on dropping your shoulder and think about the hand lifting up, and then the shoulder rotates in the socket in a smooth manner, and I don't have the neck pain, I don't have the top of the shoulder pain, and I can go all the way up. And then coming down, the shoulder stays down. And you can also see this if I go out to the side. So if I'm up here and I go out to the side, it's already going to be jammed. You can see how much higher my shoulder is. It hurts right there, it hurts right there, it hurts right there, and then finally the ball goes in the socket and I stop hurting. And the same thing is going to be true. There's pain right there, there's pain right there, and then it comes down. So now, if I have my shoulder down and relaxed and these muscles know not to pull me up, and I learn how to use my rotator cuff and then deltoids to lift me up, I think about my hand going up, and you can see my shoulder stays down, and then it just goes in the socket, and then there's no pain. So, and obviously this is something to practice in front of the mirror, and to practice it occasionally throughout your day to relearn how to use your arm. And if you're having trouble keeping your shoulder down and it wants to lift up like this, first thing you need to do is learn how to relax those muscles. Learning some of the breathing techniques I teach would help with that, in addition to some awareness training and learning how to move your rib cage. And if you have more questions, please contact me. But don't start working on lifting your arm up unless you can fully keep your shoulder down. I hope that helps. Ask questions if you have any, and we'll see you next time. Thanks. Bye.